All right, Ashley, could you tell us what all you have and what's going on with your patient? You have a patient who has an order, has a doctor's order for an NG tube placement. The NG tube you're needing to go ahead and provide them with provide him with that and educate him regarding the NG2 placement and why he's getting that, and go ahead and start talking to us about what items are required in order for us to do the placement.
Okay, so the first thing I would do is verify my order that I have NG2 placement, and I would then educate my patient on the procedure and gather my supplies. So I want to introduce myself. Hi, Mr. John. My name is Ashley. I'm your student nurse. Today I have to insert what is called an NG tube. The doctor has ordered it for you. What that is, it's a plastic tube that will be inserted through your nose, down the back of your throat, into your stomach. It's going to help to get you some electrolytes since you have been having some vomiting and you haven't been able to eat since your surgery. What I'll need is gloves. I have an emesis basin in case my patient has to vomit. I need the tube itself. I need a water-based lubricant, tape, a syringe. I need something to secure the device once I know that placement is correct. So I have my bandage for that. I also have suction in case the patient is being placed on suction. And I have water to help him swallow. Are you ready for me to begin?
Yes.
Okay. First of all, I'm going to apply my PPE. The next part is to open my tube, and I need to measure the tube. I'm going to measure it from the tip of his nose to his earlobe. So we're going to go from here to the xiphoid process, which is in the center of his chest. After I have the placement, I am going to take a piece of tape as my marker. Okay, I have my patient in high fowlish position. I have his head resting on a pillow, and I've already educated him. The bed is at a height that's suitable for me. So now we can begin inserting. I would ask him to hyperextend his neck. And since we're working with a mannequin, he won't be able to do it, but ordinarily your patient will hyperextend their neck.
Well, let's remove, for this purpose, we'll remove the pillow so we can maybe do the hyperextension.
Okay. All right.
Students, please note that we do want the patient to be comfortable, so if a pillow is preferable for his head, we can do that.
Okay. Now, I need to lubricate the NG tube about 3 inches. We use a water-based lubricant. Now that the patient's head is hyperextended, we're going to insert it with this.
And please always assess the nair to make sure that that's a nair that is not clogged, and make sure that the nair is not impede and have any issues in it as well, that it doesn't have any trauma.
Okay, now that I can see the tube in the back of his throat, I'm going to ask my patient to look forward towards the ground, and I'm going to ask him to swallow. As my patient is swallowing, I'm going to advance the tube. If he's having trouble swallowing, you can use a cup with some water and ask the patient to take some sips of water. So I'm going to advance the tube to my marker. Now that I'm here, I need to get another piece of tape to secure it to his, you got it? Okay. Because it's not going to advance all the way. To secure it to his face until I check placement. Alright, so now that it's secured to his face, it's not going to stay.
Unfortunately, because it's a mannequin, the tape may not stay.
Alright, to check placement of the tube, we use pH strips. pH strip and a 60 cc syringe. So I'm going to unclamp. I'm going to insert the syringe. I'm going to unclamp the tube. I'm going to aspirate stomach contents. If I do see stomach contents, I need to clamp the tube again, check the pH using the pH paper, and then I need to, now that I know that it's the correct pH between 4 and 5, I can now unclamp the tube and replace the stomach contents. Then clamp my tube again.
What about the suctioning?
Okay, now that I know the tube is in the correct place, I can use a bandage and actually secure it properly to its nose and to its gown. And I can suction by taking the tip of the NG tube and placing it into the suction. This way, if there's continuous suction, it will be adequate for my patient.
Will the patient need to remain in this position all of the time?
He needs to be at least elevated 30 degrees to prevent aspiration.
Very good. Anything else you would like to educate your patient on?
I want to let my patient know that if he's having any trouble with this tube, to call me. I leave the call light next to him. If it becomes dislodged, I need to replace that tube as well. And if he needs to get up to go to the restroom or anything, he can call me for assistance, because we do not want this tube to become disconnected.
Excellent.
Thank you.